So different types of musculoskeletal tissues are going to have different types of healing. So the important determinants of how well a particular tissue heals is the regenerative capacity of the tissue, the vascular supply, the extent of the damage. So that makes a lot of sense, right? The all of the different musculoskeletal tissues have different capacities for healing. Probably the one that has the least capacity for healing is cartilage, because it does not have a good vascular supply in general. Tendons and ligaments heal slowly. It's going to take probably twice as long for tendons and ligaments to heal as skeletal muscle, and the difference is the blood supply. Skeletal muscle has a great blood supply. That's why it's red. And it heals fast. And it has, skeletal muscle has great regenerative capacity, because the body is always building, breaking down and building up new muscle. So every time you do a workout, you get those little micro tears in the muscle, a strength workout. And then you're sore the next day. Well, that's when the muscle's rebuilding. So we're constantly doing that with our muscles. So if you have a muscle injury, it heals a lot better than tendon, and a lot better than cartilage. Bone also has a fabulous blood supply, and so it heals really quickly. So with the different tissues, cartilage really has a limited ability to heal. So that includes just all the cartilage that's covering our bone ends in the different joints, and things like the labrum in your shoulder and your hip, the meniscus in your knee. All of those tissues lack lymphatics and blood vessels and nerves. So the exception would be that the cartilaginous injuries that also involve subchondral bone allow the inflammatory cells to gain access to repair nearby cartilage. So say that you had a tibial plateau fracture and you damaged your meniscus at the same time. You can see how that would happen. The meniscus actually heals better, because the inflammatory cells from the bone can actually gain access to the meniscus where it normally wouldn't be able to if the bone was intact, and it can help repair that, and it can repair the cartilage on the ends of the bone as well. So I guess if you have a minor cartilage injury, it's not going to heal as well as if you have something major involving the bone as well. So I don't know what to say about that, but cartilage doesn't heal well. Tendons and ligaments, we see people all the time with tendon and ligament injuries in physical therapy. The potential for repair of tendons and ligaments depends on the type of tendon or ligament, the extent of the damage, the vascular supply, and control of movement, the duration of immobilization. So a lot of times, like say somebody has a rotator cuff repair, a lot of times they have to stay immobile, relatively immobile, for up to 6 weeks till it starts getting a little more healing, and then you can start adding in some mobilization. So the different tissues, different tendons and ligaments can have different vascular supply, depending on where they are located and what part of the tendon is affected. If it's a partial tear, it's going to heal better than a full tear. If it's a full tear where the ends are closely approximated, it's going to heal better than a full tear where the ends are far apart. And hopefully that makes sense. If healing occurs in tendons possess a unique scar tissue maturation phase that can achieve an advanced state of repair close to regeneration. So that's why tendon repair surgeries are often very successful, because tendons can mature. They can mature a scar into a functional state, and it can be close to regeneration. You can also graft tendons into people's bodies. Sometimes people have grafts for ACL tears and that sort of thing. And they can be very close to regeneration of the original tissue. So that's pretty interesting. You can also have tendons where either the tissue damage was such that you couldn't get the ends together, or the surgeon couldn't do it in surgery, and it's more difficult for the tendon to heal. So you're definitely going to have variable healing on tendons, but they do heal a lot of the time, and the healing is going to take between 10 to 12 weeks, so lots longer than, say, a muscle tear. Unlike tendons, ligaments heal better with early controlled loading and passive mobilization. So with tendons, you kind of want to keep them immobile. With ligaments, you want to mobilize them a little bit. So that's one of the things that we're going to do in physical therapy. We're going to coach the patient on controlled loading, protected loading, and we're going to apply passive mobilization. So tendons and ligaments do heal, and they usually heal pretty well, but they take longer. Skeletal muscles can be injured by trauma, muscle strain, muscle diseases. Healing can occur. Sometimes there are still muscle stem cells available that can proliferate and differentiate into the mature muscle cells. So because skeletal muscle is very plastic, meaning it changes all the time in our body, you can get good healing with skeletal muscles. Thank goodness, because if we didn't get good healing, then we probably wouldn't be able to do the kind of strength workouts that we do to make our muscles bigger. So after a severe muscle contusion, a calcified hematoma may develop, and it's called myositis ossificans. So with that calcified hematoma, that is actually going to disrupt healing. It's going to take longer. The body can eventually reabsorb it, but the treatment is going to be a lot different. So that's something to be aware of. I worked with a guy a long time ago who had a myositis ossificans from, he was playing soccer and he had a really heavy hit on his thigh, and he had it there, and you could actually feel the calcification. It was close enough to the surface you could feel it. Very interesting. There are some neurological injuries, like spinal cord injuries, where developing those myositis ossificans is a potential hazard, and we'll talk about that way down the line when we're talking about neuro. Bone is a wonderful healing tissue. Bones are very metabolically active, tons of blood supply, which is really, really great. There are at least four stages of healing of bones. There's the inflammation stage, of course, that begins shortly after the impact that breaks the bone. It creates a hematoma, it disrupts the blood supply, and it lowers the pH. You get a soft callus after swelling subsides, and all of these can be confirmed on X-ray, which is nice. You can actually see the healing, and it can also be confirmed by the real-time ultrasound. You can confirm bone healing. You can confirm tendon and ligament healing with real-time ultrasound as well. So it's not the kind of ultrasound we do, which we'll talk about in a few weeks. It is the imaging kind of ultrasound, like you get when you're pregnant, or you're going to get your tendon injury looked at. That's the kind of imaging that they do. So the soft callus begins after the swelling subsides, and it stabilizes the fracture, decreases pain, and reduces the chance of fat embolism. So the fat embolism comes from the fat in the medullary canal, potentially with bone breaking. The hard callus forms in 3 weeks to 4 months, and that corresponds to the clinical healing period. So bone remodeling takes months to years. So healed fibrous bone is converted to lamellar bone, and the medullary canal becomes open or patent again. So bone remodeling is constantly going on, because our bones, not only are they structural for our body and they're the levers with which we move, They are also a storage for minerals in our body. So there's storage for calcium, there's storage for phosphate. So the calcium stored in bones is constantly being taken out, used, and redeposited. So bone remodeling goes on and on. And you'll probably recall in kinesiology when we talked about Wolff's law, how bone changes in response to the forces that are applied to it or the stress that's put on it. And so bone remodeling takes weight bearing and takes exercise to remodel. So but bone is a fabulous tissue for healing because it's got that great blood supply and it's got a very clear healing path. So that's why a lot of times when someone breaks their leg, if it's a clean break, they don't need therapy necessarily because the bone knows what to do, or you've got everything going for healing. So a lot of times after a nice tibial fracture, or not that there's a nice fracture, but a nice clean fracture, it's a lot of times they cast it and it heals really well. So yay, we like that.